Ashton Peroni, a naturopathic doctor at Time Health, as you guys know. Um, I know that we just had a presentation on stress and anxiety by Dr. Ben, I believe his name was. But I just think that it's a really important topic to talk about. And I talk about it with probably every single patient that comes into my office. And with the current pandemic going on, it's just so prevalent in the world today, right now, and always, really, especially in this society. And I don't think that a lot of people really talk about the long-term effects of having stress and anxiety. So that's really kind of what I wanted to get into. So just a little quick catch up. This is our rest and digest, which is the parasympathetic system, which is this side, which allows us to properly digest our food, allows us to use the bathroom, have a slower heart rate. Our pupils are pretty like normal sized. And that's just kind of normal. Like I'm sitting on the couch reading a book or watching a non-stressful TV show or something. And then the sympathetic system is our fight or flight. This is what happens when we need to run away from a bear, or, and that is typically in terms of being animals, what is usually what our fight or flight system is used for. So we're pretty much the only animals probably on the planet that can sustain long-term stress and that do sustain long-term stress. One of the first books that I read introducing me to naturopathic medicine was called Why Zebras Don't Get Ulcers. And literally the entire book was about why zebras don't get ulcers, why we're probably the only species that get ulcers. And it's because of the way that we sustain long-term stress. So typically short term this is what's going to happen is our pupils are going to dilate so that we're able to see better while we're running away from this bear. It's going to inhibit anything that is not necessary for us to run away from a bear, which is our digestion. We don't need to digest our food. We're not going to need to use the bathroom. We're not going to need to produce reproductive hormones or really any other hormones besides cortisol, epinephrine, and norepinephrine, which are going to give us the energy that we need and the stamina that we need to run away from the bear. So some of the short-term symptoms that people experience are just kind of the usual. I'm sure that there's not a single person in this Zoom call that has not experienced anxiety and hasn't experienced some of these symptoms, whether it's increased heart rate or difficulty sleeping because you can't get your mind off of things, lack of concentration, shortness of breath. A lot of people will experience when they're kind of like immediately anxious or in experiencing a panic attack sometimes. I know that for myself, I don't realize that I'm anxious until I start holding my breath. So that's how I know. Changes to bowel movements. Some people can have diarrhea and or constipation, or sometimes alternating. Your stomach might be upset if you're anxious or nervous about giving a presentation. And then some people will actually go into some dizziness or shaking and extreme fatigue. So those are kind of like, hey, I'm anxious today. This is what I'm feeling. And normally that response is supposed to be really short term. Like you ran away from the bear and now you're safe and everything's fine. And your body can go back to processing things the way that it usually does. So your digestion will turn back on, your hormone production will turn back on, and everything will go back to normal. But for us, especially, you know, just the society that we've built in around this country specifically, it's not really, they don't really see this in other countries as much because things are just a lot slower. But here it's very go, go, go all the time. And you're always doing something. You always have something on your mind. You always have a schedule. And so long term, I mean, just think about how that can affect your digestion. If you're stressed for 8 hours a day and you're experiencing anxiety for an 8-hour period, your body's not digesting food properly. Your digestive system is not even really turned on. So you may experience abdominal pain, decreased absorption of food. For some people, it's either when they're really stressed and anxious, food will just go right through them. And some people, they'll actually get more constipated where they'll hold on to things a lot. So they'll have more bloating and pain versus like diarrhea and lack of absorption. So it can really go either way. And that's usually like irritable bowel syndrome. And I think what a lot of people don't talk about is how it affects your fertility. And I know from working with women who have been trying to get pregnant, it's really frustrating for them to hear like, oh, you just need to calm down and it will happen. You just need to stop stressing over it and you'll get pregnant. And it's not that simple, obviously, to just turn off stress and anxiety, but it really does affect your fertility because it's going to disrupt your production of hormones. If you're stressed for 8 hours a day, every single day, you're not going to be producing your reproductive hormones the way that you're supposed to. And especially for women, our hormone production is very cyclic as it is. And any kind of disruption in that cycle can cause hormone imbalances down the road. So you can have like an estrogen excess or a progesterone deficiency. Any really combination of hormone disturbances can cause infertility for a lot of women. And then when we're stressed, we get a lot of chronic fatigue happening due to adrenal burnout, because the adrenal glands are these little tiny glands that sit on top of the kidneys. And that's what releases our cortisol and our epinephrine and our norepinephrine, which are our stress hormones. And so if our adrenal gland is constantly pumping out those hormones, then it's going to get tired, because it's not supposed to do that constantly. It's supposed to do it periodically, not consistently. And so it'll get tired, and a lot of people will actually, their cortisol will end up dropping really low. And that's what causes kind of the chronic fatigue and the adrenal burnout, because the cortisol usually gives you energy. So then even though you're stressed, your body is no longer really producing adequate stress hormone because it's just too tired. A lot of people will notice kind of a chronic illness or a decreased immunity, because when you're running away from a bear, it's not really necessary for your body to be fighting off infection. So that's not your body's priority. And a lot of people are more susceptible to viruses and bacterial infections. And then some people will experience chronic migraines, eventual heart disease if they are experiencing increased blood pressure or heart palpitations long-term over periods of many years or decades, and the insomnia as well. And I've talked to a lot of people who don't really think that they have anxiety. And I had a patient recently explain to me, I was like, well, what, do you experience anxiety? She's like, no. But then she couldn't sleep. And I asked her what kept her awake at night. And she said that, she's like, oh, well, sometimes, my brain just starts thinking, and I start like planning my birthday that's in 8 months. And I just start doing this and that and the other thing. And I was just like, yeah, you just explained anxiety. You're experiencing anxiety. You can't shut your brain off. You have constant thoughts. So a lot of the things that I have people do are breathing exercises is probably something that I coach almost all of my patients through. And you guys have all experienced those with Patricia. But the vagus nerve goes from our brain down through our diaphragm. And that's the nerve that stimulates, when it is stimulated, it has the parasympathetic system turn on, which is our rest and digest phase. And so when you're stressed, you're usually breathing shallowly through your chest, not through your stomach. Most people don't even activate their diaphragm when they're stressed. And so making sure that you're breathing deeply and activating your stomach when you're taking a breath will stimulate that vagus nerve to activate and turn on the parasympathetic nervous system, which helps calm your anxiety and calm the body. Same with meditation, is a lot of deep breathing, but it also is just very calming for a lot of people and relaxing. So really trying to focus your body on doing things that are more relaxing, things that bring you joy. For some people, that's exercising, which it's not really relaxing, but it helps calm the anxiety. So for people who are experiencing adrenal burnout, I usually recommend doing more restorative exercises, like yoga or Pilates or something that kind of ties in meditation a little better, even if it's just walking in nature or taking a hike. Mindfulness. I read a whole book on mindfulness, and it was really just talking about when literally you're doing anything, like you're washing the dishes, instead of thinking about all the millions of things that you need to do later in the day or tomorrow, you should be really focusing on actually washing the dishes. You're putting the soap on your hands, you're putting water on your hands, because that's keeping you present. And when we're present, typically people are less anxious, versus when they're thinking about all the things that they need to do in the future. That's typically what's causing more of the anxiety. keeping yourself on a schedule. Our bodies like schedules, especially food schedules. So eating breakfast, lunch, and dinner at the same time every day, making sure that you're starting your bedtime routine at the same time every day, even just showering at the same time, just doing things that your body can depend on physiologically makes us less anxious as well. And then I always love energy work, whether it's breath work or Reiki, craniosacral, just holding crystals, whatever it is, I think is always really great. And then there's always herbs that I love to throw in for people, whether it's adrenal support, which I'll usually give to most people, which includes a lot of these adaptogen herbs that kind of just nourish the adrenal gland and help the body manage stress better over time. So for a lot of people, and it takes a while, but sometimes it'll be like, oh, down the road, all of a sudden, I'm not as reactive to this situation as I would have been 3 months ago. So those are kind of the adaptogens that help you adapt to stress over time. And then there's the relaxing nervines, which really just help calm the nervous system in the moment. So drinking lavender or chamomile tea, any of these herbs, lemon balm, passion flower, kava, they're very relaxing to the nervous system and will kind of help get you out of that anxious state in the moment. So yeah, I recommend stress management for everybody, and I'm sure that a lot of you can relate to this and hopefully use some of these techniques. And I am available for questions. Oops. Hold on, let me stop my screen. Okay, there we go.
Ashton, I have a question.
Yeah.
What is, okay, I've seen this word over, kind of embarrassed to ask, but there was something on the slide, is it, and if I don't pronounce it right, I apologize. It's chakra?
Chakras.
What is that?
So it's a form of energy that and Jana might actually be able to explain this better than I can, but they're like energy centers in the body, and supposedly there's 7 chakras that kind of line through the middle. So you've probably seen a picture where it has like colored circles, like in the third eye, the throat. I can't remember what the center one is called. And then there's like pelvic and floor. So it's more for energy work, and when your chakras are imbalanced, then your whole like energy fields are imbalanced.
Oh, okay. I've been seeing that over everything, and I'm like, what is this?
Yeah.
Thank you.
You're welcome.
I have a quick question, Dr. Ashton.
Yeah.
Is there any time you feel like people shouldn't take any adaptogenic herbs? Like, is there any contraindications with that, or can you overdo it at some point, or take a break or something like that?
Shouldn't take them.
I take them every single day, and I'm like, should I calm down a little bit at some point on these? But asking for a friend.
Yeah, asking for a friend. I guess the only time I would say maybe it's too much is if you go more into like a depressive state, which I don't think that they really will do, because they're more about just like optimizing adrenal function. But for some people are really sensitive to them, and some people will actually get like groggy even taking lower doses of some of the adaptogen herbs. So I guess that would really be the only time that I would say either too much or maybe you're too sensitive for that.
Interesting. Okay. It's definitely like a chemistry thing.
Yeah.
Interesting. Thanks, Dr. Ashton.
You're welcome. Any other questions?
Just a comment. This is a great presentation.
Oh, thanks, Eric.
I don't think I ever really understood what anxiety does to you. And I thought, oh my God, this is a list of my life.
Yeah, most people think that when they hear it. And that's like a lot of people experience kind of the short term where you're in the moment, but how does it affect you over time? I think a lot of people don't realize.
Right. Thank you.
You're welcome.
Yeah.
Cool.
Any other questions?
Yeah, just what's good to help you? I have trouble sleeping, and the Ambien, I shouldn't be doing that every night, I suppose. Not funny, Eric. Anything you recommend?
Again, my life, Larry. My life, Larry.
Ambien works really well, but I've been told not to do it every night.
Yeah. I think it depends, Larry, on what's keeping you awake. Is it stress that's keeping you awake?
Probably.
Then working on some of those stress management things, drinking maybe some like bedtime teas are really helpful for a lot of people. And you can get like really any of the blends that they sell at the store that are like sleepy time or bedtime teas have most of the herbs that I talked about. But then also just working on kind of managing your stress throughout the day. Having more of a routine at night is really helpful. So like not watching stressful TV shows at night, or turning the TV off at a certain time, making sure you're eating dinner at the same time, and kind of like having a relaxing evening, not working until the second you go to bed.
Okay. I'll try that.
I used to take a while ago the valerian roots, you know, that's the natural. And if you take like 1 hour before you're getting to sleep or so, it kind of relaxes you and kind of helps you to sleep. And it's totally natural. You can buy the organic valerian roots. It's like a couplets or tablets or so. That will help you too.
Yeah, valerian's really great.
Oh yeah. Okay. Thank you.
Great. Well, the only way to hear more about Dr. Ashton is to schedule a one-to-one with her.
Yes.
And then log it. So